So I'm just gonna wait for everybody to come now as we start this live. Just gonna wait for the next 4 or 5 minutes. Let's just wait. All right. Okay, I think we're coming now. We're just going to wait for a few seconds for others to join us. We're just going to wait for a few seconds for others to join us. If you're just joining us and if you're just coming across this channel for the first time, welcome to Nurses Lecture Room. My name is Mercy Mary, and I make learning easy and accessible for all my viewers. Okay, so we have Uchenna. We have Uchenna Success Enzuma said hi. We have Kotel Mohammed Lami said hi. We have Afunugeya said hi. Hello everyone and welcome to our live. We're just going to give others time to join. But if you can meet up, if you feel this topic is not important to you, feel free to join in our next live. All right. Hmm? 23. So I'm just going to give a few seconds for others to join us, then we can officially start the live. If you are coming across this channel for the first time, my name is Mercy Mary. Like I earlier said, I'm a registered nurse midwife. And on this channel, we talk about those things that you're scared to ask your doctors about. And those things that your doctor might not have enough time to actually explain to you in details. And also, we talk about those things you want us to explain. You're just curious to know because you're human and you're a man or a woman. You're just curious to know these things. So we talk about all these things on our YouTube channel. So here, welcome, and we are going to be talking about sexually transmitted infection. That's what we're going to be talking about. And if you're watching, kindly drop on the comment section and feel free to let us know where you are watching us from. So whether you are sexually active, you are exploring, or you're just curious, this particular live section is for you. So I'm just going to wait for others to join us because we just ended one particular live. Here we are talking about the question and answer section. So this is another live. We're starting another live. So I'm just going to wait for others that were part of that live to join this live so that we can dive into action. And Kabbalah, thank you for joining Mohammed Lami. So just going to give others in the next 1 minute, then we are going to start talking about this STIs testing. So if you have any question, feel free to drop on the comment section. In between these classes, I'm going to be taking your questions. If you have any questions, feel free to drop the questions in the comment section. All right. If you have any question in regards to STIs, how, when, I'm going to be explaining it, but feel free to drop these questions in the comment section. So we have Nelsie. Nelsie, how are you doing? And trust you are doing great. I just want to let you know that this space is actually a judgment-free zone. We are here to talk facts, drop myths, and also empower each other. So that's what we are here to do. So I want to ask a question before I go ahead. We're trying to make it more interactive and engaging as much as we can. And the question I really want to ask is, have you ever had an STI test before? Just type yes, no, not yet. Have you ever had an STI test before? Have you ever had it in your entire life? Have you ever had it done before? Like you went to the hospital, you're like, oh, I want to check if I have any sexually transmitted infection. I want to check for gonorrhea. I want to check for diabetes. Sorry, I want to check for gonorrhea. I want to check for syphilis. Have you ever had it done before? Have you ever had any of these tests done before? Mohammed said not yet. All right, let's wait. I would like more answers in the comment section. Have you ever had an STI test done before? Have you ever had an STI test done before? So let's start with the big question. Why getting bothered? Why do you want to get a test done? Why do you want to see the doctor? Why is it very important for you to get this test done? It is very important for you to get this test done. Fatmata said no. All right. Let's talk about why it's important, why this particular test is important. It is very important for you to get this test done because STIs are very common. They are very common, more than you ever think of, like more than you can ever think of. STIs are very common. Don't think STIs are rare. Don't think STI occur once. STIs are common. Every day in the hospitals out there, people are coming to test for STI and they test positive. So STI is not something that's rare. It is very common. And the good news is that most of these STI, they are treatable and they are manageable. Most of these STIs, they are treatable and they are manageable. And the earlier you know this, the earlier you get it treated, the earlier you get it manageable, the better for your overall health. All right. It is also very important for you to go for testing because most STI or many STIs have no symptoms at all, like zero symptoms. You will have them, you will feel totally fine, but but you can still pass it from one person to another without knowing that you have it. So for those that feel that if you have STIs, you're going to see those signs, you're going to see those burning sensation, you're going to have difficulty white peeing. Some STIs don't show single symptom at all. They don't show any symptom at all. So that is why it is very important for you to go for testing. That is why it is very important as a man, as a woman, especially if you are sexually active, to go for testing regularly. All right. Now, the question is, how is this STI test done? How do they go about it? So the test depends on what is being tested for. So different tests have different routes. Let's put it that way. All tests don't go through the same route. So for some tests, you have to do some urine tests. Others, you have to do some blood tests. You take some urine sample, you take some blood sample, some you take some mouth swab. You take swabs from the mouth, you take swabs from the genitals, you take swabs from the rectal region, which is your anus, where fecal matter comes out. That's for those that practice anal sex. Then also there are some that do some physical examination. From the physical examination, they're able to pinpoint it could be this, it could be that. But it's very important that this testing are being done because with these tests, you're able to know if you have or not. Okay? You're able to know what to do at a particular time. So when it comes to testing, like I earlier said, the samples are taken from urine. We have blood samples, we have swabs, and this swab, they bring something like looks like a cotton board, like let's just say a cotton board. They use it like if it's a mouth swab, they use it to pass through your mouth. If it's like a vaginal swab, they use it to go through, like they take some swab from the vaginal, depending on what they are testing for. So these are the how the testing is being done. Then also, I just want to let you know that you don't need to get every single test every time. It depends on you. It depends on you. It depends on your partner. It depends on your sexual activity that you're involved. It also depends on the symptoms that you're showing, and it depends on your gender and anatomy. So that is what determines what particular test you're going to be doing, what sample they are going to be taking. So you may want to ask, when do I get tested for STI? When do I get tested for STI? So the first part is if you are to get tested for STI when you have a new partner. You heard me right, yes. I know this is actually very difficult for us to practice, but when you have a new sex partner, it is very important for you to get yourself tested and also for your partner to get themselves tested, just to be in a safer line, just to be in a safer space, just to make sure both parties are okay. All right. And also, if you have unprotected sex with no condoms, if you are the kind of person that usually have unprotected sex with no condoms, it is very important for you to go for testing every 3 to 6 months. If you are having unprotected sex, it is very important for you to go for testing every 3 to 6 months. And also, if you start showing symptoms, increase in body temperature, itching, you get some swellings in your genitals, you get some redness in your genitals, you get some burning sensation in your genitals, it is very important, especially when you start seeing these symptoms, to rush to the doctor and get tested as soon as possible. And even if you are not sexually transmitted, like you are not sexually active, or you're sexually active, but you just have one sex partner or something, it's very important for you to go for testing at least once a year. Once a year, get these things tested, get these things checked out, because the earlier you know them, the better for you. But if you keep running away from it, like you keep running from it, I don't want to get it tested, something might be building up there. Because like Ella said, some STIs, they don't show symptoms. Some STIs, they don't show any signs. So that is why it is very paramount for you to get tested. It is very paramount for you to get tested. It is not free. Cartel, it is not free. You have to, depending on your country though. There's some country that healthcare is free, while there's some country that you need to pay for healthcare. So it all depends on your location, and it depends where you are. That's just it. It depends on where you are, the insurance you are, if you have any health insurance. That's what is going to determine if you're going to get it for free or not. All right. So do we have any question before we go into the myths? Do we have any questions before we go into the myths proper? So there are some myths about STIs, and one of it is that you only go for STI testing when you have symptoms. I think I've already explained that before. You don't only go for STIs when you have symptoms. No. Even if you are not showing any symptoms, it is very, very important for you to go for testing. All right. Then oral sex cannot transmit STIs. That's a lie. Oral sex can transmit STIs. So I think you should take note of that. Okay, Kote, what's your question? Let me know in the comment section. What's your question? You think you have a question or you have a question? If you have a question, just drop it in the comment section, please. If you have any question in regards to STIs, just drop in the comment sections. I will be willing and ready to take the questions. I'm ready for your questions now. And if you are watching this live, feel free to double tap the screen and like the video. And don't forget to subscribe to our YouTube channel. Turn on that notification bell, just in case we pop up any video. You are first on the list to watch the video. Hello, ma. I have been seeing my ovulation. What do I do, please? You have been seeing your ovulation, or you have not been seeing your ovulation. What are you trying to ask, Olem? Olem, what are you trying to ask? You said, hello, ma. I have been seeing my ovulation. What do I do? If you are seeing your ovulation, that's a good thing. That's to show that you are. That's to show that you are fertile. Let's put it that way. That's to show that there's an increased chance of you giving birth and having kids. So I don't know if that's your question. It doesn't seem clear. You said, hello, ma, I have been seeing my ovulation. Seeing your ovulation is a good thing as a lady. Seeing your ovulation is something great. So I don't really know your question. What do you want to do? Do you want to avoid pregnancy? Do you want to get pregnant? What in particular do you want to do since you're seeing your ovulation? Bakari said, is Staphylococcus aureus considered as an STI? Staphylococcus aureus is not an STI because of the way it's being transmitted, but sexual intercourse can increase, like, can put you at risk of getting it, but it is not an STI. Staphylococcus aureus is not an STI, but sexual intercourse can kind of put you at risk of going down with Staphylococcus aureus. So, Odimego Chidima, how are you doing? Trust you are doing great. Conte said, but if my partner did not agree, what should I do? If your partner did not agree with what? If your partner did not agree with what? I think your question is not clear, Lami. Diamond Weight Loss said, hi. Diamond Weight Loss, how are you doing? And trust you are doing great. It's nice having you on our live today again. So if you are watching this live for the first time, this is the first time you're coming across this channel. My name is Mercy Mary, and I am a registered nurse midwife. Feel free to double tap and like the video. Double tap and like the video. It doesn't really take much. And also feel free to subscribe to our YouTube channel and turn on that notification bell so you don't miss out. And if you have any question, feel free to drop on the comment section. I will be willing and ready to take your questions. Okay, Esther Olem said, I have not been seeing my ovulation. Okay, why do you feel you have not been seeing your ovulation? Are you having irregular cycle? Like, does the menses come every 3 months? Like, why do you have that feeling as a lady that you're not seeing your ovulation? There could be signs. One of the reasons that will make a lady feel that she is not seeing her ovulation is actually the absence of her menses. So do you have regular menses? Are you seeing your menses regularly, or you are no longer seeing your menses regularly? The windows are open. People still get syphilis. Yeah, people still get syphilis. People still get gonorrhea. STIs are very common. STIs are very common. People still get syphilis and people still get gonorrhea. If you are watching, just double tap the screen and like the video. Tap the screen twice and it automatically likes the video. Feel free to subscribe to our YouTube channel and also turn on the notification bell so you don't miss out on any of our forthcoming videos. And if you have any questions, feel free to drop in the comment section. Feel free. Somebody asks, can you get it in the UK? Yes, the prevalence of syphilis has been increasing, so you can get syphilis in UK. There's syphilis in UK. So it's not like syphilis is in Nigeria, it's not in UK, or syphilis is in Dubai, it's not in UK. Syphilis is in UK. It's a sexually transmitted infection. So when someone is traveling, they don't do STIs testing for them. All right, they can be transmitted through sex anywhere around the world. So Esther Olem said, I have not been seeing my ovulation. I'm trying to get pregnant. That's why I'm asking Esther, how did you know you have not seen your ovulation? What signs? Did you see your menses? Are you seeing your menses monthly, or you are no longer seeing your menses monthly? So that's the first question. Are you seeing your menses monthly, or you are no longer seeing your menses monthly? No, syphilis is still in the UK. It's increasing in recent years, though there was a slightly decrease in 2024, but syphilis is still in the UK. It's not in the 60s. There's still syphilis, there's still gonorrhea, there's HIV. These are all STIs. They are still in existence. They are very, very common. So that is why it's very important for you to go for testing. That is why it's important for you to go for checkup. Esther Olem, I think your question is not really straight. I don't know if you get what I asked. Pop your questions in the comment section. Pop your questions in the comment section, please. Let's keep the questions coming. Let's keep the questions coming. If high blood pressure shows up to, does it mean it will never go down? It will go down. First of all, if your blood pressure is 160, 100, if it's the first time you are testing it, you are checking the blood pressure, and it's 160, 100, the healthcare practitioner might advise you to wait, to check it again. They might monitor it and see, maybe check it regularly. If they see this high blood pressure is consistent, despite checking it different times, despite checking it regularly, they might decide to put you on some antihypertensive medications, like your blood pressure medications. And also, what I advise generally, if you are on some antihypertensive medications, which are some blood pressure medications, it is very important for you to work on your lifestyle. When I talk about lifestyle, I mean what you take in. Yes, it is very, very important for you to work on what you take in. Practicing healthy lifestyle is going to go a long way to help you with the 160, 100 blood pressure. If you don't take your medications, you are not working on your lifestyle, it might just stay same. It might not go down. But if you are working on your lifestyle, you're taking your medications prescribed by your doctor, definitely it's going to go down. All right. So Bakare said, as a man, if one had unprotected sex, how long will it take to notice any STI? Like I earlier said, you might have unprotected sex and the symptoms will not surface. Most or many STIs, let's use many STIs out there, the symptoms do not surface. They don't show. It will just be in your body, and you keep transferring it from one person to another without knowing you have STIs. Why some, it depends on the incubation period. The incubation period takes longer to surface. That's to stay in your body, not even to show symptoms. Why some, once the incubation period is done, you start seeing the symptoms. All right. So some don't show any symptoms at all. You will feel fine. It will look as if nothing is happening to you, but deep down you have an STI. So Bakari, I hope your question is cleared. That is why regular testing is very important. Like I earlier said, if you are having unprotected sex without condom, it is very important for you to have regular testing every 3 to 6 months. Esther Olem said, my period always change, sometimes 27, 28, 25. The lowest is 25 and the highest is 30, which is 5 days difference. So that is okay. That is normal, and I would say that is regular. Esther, so that's fine. Like I earlier said, I think you dropped this question in the previous live. Like I earlier said, a lot of things can delay your menses, and also can make it come earlier than the start date. Things like stress. If you are stressed out, it can affect your menses. Yes, it can delay it or make it come earlier. If you take any emergency contraceptive like Postino 2, you're always taking it, that can also alter your menses. That can make it come earlier or come later. Then if you are if you are on any medications such as malaria, antihypertensive, antidepressant medications, any medications at all, sometimes these medications have negative effect on your meses. So that is why it is very, very paramount for you to always talk to your doctor about the side effects of the medications you are taking. But from what you've given me, 27, 28, 25, 29, 30, it's a normal cycle. It's not something of concern. Diamond weight loss. Men cannot get period except men that are bisexual. Is it bisexual? Is it the right word I want to use? Hermaphrodites? Is it, did they call them hermaphrodites? I think there's a male, there's a more better words to use. Men that have intersex. Yeah, if they are intersex. Thank you, Gamma. Intersex, I think. Yeah, that's the right word to use. Yeah. If an individual is intersex, they have both the men characteristics and also the women characteristics. So if they are intersex, it's possible for them to get their period. And also, Gamma, did you get the answer to your question in regards to high blood pressure? Yes, I'm diabetic, but the BP was first mentioned a week ago. Yeah, like diabetes and blood pressure, I think they are very related. Yeah. When one has BP, there's a chance that when one has diabetes, there's a chance that the blood pressure is going to be affected. Like when you have diabetes, there's an increased risk of being diabetic, being hypertensive. I mean, sorry, I don't know if you get what I'm saying. When you have diabetes, there's an increased risk of you being diabetic. And when you have the yeah, when you have, what am I trying to say? Sorry. When you have diabetes, there's an increased risk of you having high blood pressure. Okay, so that's why it's very important for you to manage it. Now the doctors have measured into you. I think you should ask the doctor what's next, what they advise you to do. Like I always say, healthy lifestyle goes a long way. For diabetic and also hypertensive patient, healthy lifestyle is key. Change of diet, avoiding smoking, alcohol, all these things go a long way when it comes to living healthy with diabetes and also high blood pressure. That Taiwo said, I just had CX 7 weeks ago, and lately I am discharging yellowish white mucus. Please, what could be the cause? Though I've used fluconazole and flagyl, still seeing the discharge. So it's possible you're bleeding, like the normal bleeding after your delivery is gone. You know, after giving birth, you're expected to like bleed. Should I use the word bleeding? You're expected to see blood in your panties for some time, at least the highest 6 weeks. By 6 weeks, you should dry off. So I believe that yellowish discharge, that yellowish white mucus or discharge are still part of the things that are going out of your body. Yeah, as far it's not smelling, it's not itching, and it's not causing unnecessary discomfort, you are not having increased body temperature, I would say you should allow your body be, because it's possible that is what is coming out of your body after childbirth. The blood stage is gone, and this mucus is more or less like the last phase. So that's what personally I would advise you to do, but consigned, see the doctor. Dada Taiwo, did you get that? Mohammed Lamy said, what causes frequent urination? There are different causes of frequent urination, and one of it is infection, urinary tract infection, sexually transmitted infection can cause frequency in urination. Then also diabetes, like someone said that she has a diabetes, he has or she has diabetes. Diabetes can make someone pee regularly. Urinary incontinence, your bladder is not able to hold urine properly. That can actually cause frequent menstruation. So one thing is to go to the hospital and get to find out what is the cause. So when that urinary incontinence is coming with painful urination, is coming with burning sensation during peeing, that can signify either STI, sexually transmitted infection, or UTI, urinary tract infection, or something else. So I don't know if that is clear, Mohammed. I believe your question has been answered, Mohammed. So Dada Taiwo said, yes, I did. Thanks. You are welcome, Dada Taiwo. Then we have Esther Olem said, hello, ma. I'm not seeing the signs of ovulation. What do I do? First of all, Olem, I think I've answered your question. I said your period are normal. If you can, like, what I can say, if you are not seeing the signs of ovulation, one of the signs of ovulation is actually this what I call it now, this egg white discharge. Is it egg white? I'll call it now slippery discharges, like from the vagina during ovulation. Then increase in body temperature during ovulation. So what I advise you to do, you can get a temperature chart. You check your body temperature every day. Since you are not sure of when you're ovulating, check your temperature every day and chart it. During your ovulation, you are going to notice a difference. During your ovulation period, there's going to be a spike in that your temperature. If you keep charting it every month, you will notice that at a particular time it goes up. You are not sick, but at a particular time it goes up. That's going to give you a clue that, oh, ovulation is around the corner, ovulation is here. Okay, so that can also help. Then also check your sexual urges during your ovulation. So during ovulation, there's always an increased libido. There is usually an increased libido. There is usually an increased sexual urge compared to the other days of your cycle where you are usually dried and the sexual urge is a bit down. So I don't know if that is clear, Esther. You can also look at temperature if the other things are not working for you. And if you are trying to conceive, you can actually get an ovulation test strip used to test for your ovulation. And how you can also test on the ovulation, what I would advise you to do personally is, since you have an average of your cycle, subtract 14 and work towards the 11, 12, 13, 14, 15, 16 of your ovulation. Use the PT strip, and I believe that is going to go a long way to help. Esther, just let me know if you get the answer to your question. So we have KB Boy. KB Boy, hello, how are you doing? Trust you are doing great. We have Gamma. Gamma said, how can I increase potassium so the body absorb it? What foods and supplements? In terms of foods that are rich in potassium, we have fruits and vegetables. Fruits and vegetables are rich in potassium, especially bananas. You see, bananas are very, very rich in potassium. So if you want your body to have a lot of potassium, it's advisable for you to take bananas, spinach, green leafy vegetable like spinach, potatoes. Potatoes are also very rich. Then if you have access to avocados are rich in potassium. So eating this food rich in potassium is going to help your body take in that potassium. Like I earlier said, bananas, spinach, avocados, and sweet potatoes. There's some lettuce, some beans, some seeds. Some nuts like walnuts, cashew nuts, all these things are very, very good. There's some dairy products can also help with they can also help your body with potassium. Then you can get some supplements. You tell your doctors they are going to give you some supplement. There's some supplements that have potassium. The other time I said, please, what can I use to clean my baby's tongue due to breast milk remnants? I think that happened to my baby a lot. So there was some remnants in the tongue. So what I normally do is to get like a cotton wool, like a small cotton wool. You put warm water while bathing. Just make sure you clean morning and evening while bathing him. Like cleaning it morning and evening is going to like help clean away the residue. Then there's also this this is this silicone toothbrush for kids that you put in your finger that you can use to wash. That is going to go a long way to also help with the breast milk remnants from the mouth. So Dada, I don't know if your question is cleared, if your question is answered. So Fatmata said, do ovulation comes before menstruation? Yes. If there is no ovulation, there is no menstruation. So ovulation generally comes before menstruation. Ovulation comes before menstruation. Ovulation comes before menstruation. So Cortez said, what milk did into the body? Are you trying to ask what milk does for the body? What intake of milk does for the body? Milk generally, they are excellent source of calcium and phosphorus. They are excellent source of calcium and phosphorus, and they help with your bone development. They help with your bone health. They make your bones stronger. They also help with muscle function, your immune system. But generally, I know milk to be very good when it comes to bones and your dental health. So that's one thing I know. Milk is very good for your bones because they contain a lot of calcium in it. So I don't know, Lami, if that's your question, you're trying to find out what milk does for the body. I don't know if that's clear for Lami. Lami, let me know if you get the answer to your question. Okay, Lami said yes. Okay, that's good. All right. So feel free to drop your questions in the comment section. Do we have any more questions? Oh, my water is finished. If there is no question, I might be going offline because I think I'm getting tired. If there's no question, I will be going offline in 2 minutes time. Esther Olem, you're welcome. If there is no question, I will be going offline in 2 minutes time. And if you have not subscribed to our channel, kindly do so. Gamma is dropping a question. How do I increase testosterone with those conditions? Which condition? Because I have a lot of questions, Gamma. I don't know which condition you're talking about. Okay, diabetes and blood pressure. Like I earlier said, healthy lifestyle generally plays a role. Healthy lifestyle. That's one way you can actually increase testosterone with these conditions like BP and also diabetes. Healthy lifestyle is key. Healthy lifestyle, veggies, your bananas, your spinach, your avocados. Those natural source of nutrients is what you need more than your processed food, more than your caffeinated food. So exercising a little, but not too much, because too much of exercise actually kills testosterone. Too much of exercise is not good for your testosterone level. And also you have to check on your weight. Are you having a healthy weight? Are you underweight? Are you overweight? Because once you are overweight, that has an impact, or you're obese, it has an impact on your testosterone level. Prioritizing sleep is very important. You have to at least have 7 to 8 hours of sleep, since you want to increase your testosterone with that. You understand what I mean? So you have to have good sleep. You have to prioritize your sleep. Like having at least 7 to 8 hours sleep a day is going to go a long way to help. So that's what I have to share. Dada said, lastly, my husband usually feels constant chest pain. What is the cause? There are likely going to be different causes of chest pain. Yeah. His work might be a predisposing factor. Is he lifting too much? Like lifting things? Like, you understand what I mean? But what I advise generally, what I would advise you, let your husband see the doctor since the pain is constant. I can't really pinpoint the cause because there are thousands of causes of chest pain. So what I would advise you to do is to let your husband see the doctor. Taiwo Dada said, please, Ma, when next will you be streaming? We are going to be streaming tomorrow, hopefully by 9 p.m. Between 9 p.m. to 10 p.m. I should be in live tomorrow. So Lami said, where did we have infection? Lami, your question is not clear. Lami, your question is not clear. All right, since there's no question, I'm feeling a little bit tired and sleepy. So I will have to end the live, and we are going to see you all tomorrow by what time now? By 10 p.m.-ish. All right. So thank you everyone for joining our live section today. I think my energy level is very down now. Thank you very much for joining our live section today. And don't forget to join us tomorrow. If you've not subscribed, kindly click on the subscribe button and turn on that notification bell. And if you've not double tapped to like this video, all you have to do is to double tap the screen and it automatically likes the video. All right. So thank you all. Bye and see you in our next live.